positive coronavirus cases here in Massachusetts, more than doubling just since yesterday, now at 92. Governor Charlie Baker stepping up the state's response. This afternoon, he joined roughly a dozen other governors in declaring a state of emergency and called on business owners, schools, and other organizations to take action now.
At this time, the number of people infected and requiring medical attention is very much within our healthcare system's capacity. The number of people in isolation and sick right now has minimal impact on commerce. The purpose of moving forward with these measures now is to act before the numbers increase to a point where the virus spread is severely impacting the Commonwealth. The highly contagious nature of this disease means that if everyone plays their part in slowing the spread, the number of people who become infected and require medical attention doesn't spike all at once, which would overwhelm many of our systems.
Earlier today, Boston Mayor Marty Walsh pulled the plug on the annual St. Patrick's Day parade and breakfast. And for their parts, Harvard University, Amherst College, Smith, Middlebury, and MIT are all moving classes online in the coming days. At this point, conversations about whether to stay open or shut down are happening at just about every organization across the state and country. And while thousands are being told to self-quarantine around the nation, many fear a future like Italy's, where the entire country, 60 million people, now are on lockdown until at least April 3rd, in an effort to slow the spread of coronavirus, which has killed more than 460 people and infected close to 10,000 there that we know of. So are Massachusetts and the United States getting it right, or should we be more like Italy? I'm joined now by Sandro Galea, who's the Dean of Boston University's School of Public Health and the co-author of the forthcoming book, Pained, Uncomfortable Conversations About the Public's Health. Dean, it's good to see you. Thanks so much for being here.
Good to see you, Jim.
Baker, as I said, roughly the 12th governor to declare a state of emergency. Is that the right move, and is it enough for our state?
It probably is the right move at this point in time. Is it enough? It depends on what we do with it. And it's also hard to say what the right move is, frankly, tomorrow. As you said, cases have doubled between yesterday and today. Are they going to double again tomorrow? And that remains to be seen.
One of the things the governor also says the private sector should follow the government's lead where appropriate.
Yes.
I'm not exactly sure what that means. What is it? Mm-hmm. What is appropriate and what is not on this particular day?
Well, I think it's a good question because the science is not very clear on this. We know that social distancing makes a difference. The governor referred to the fact that we hope to implement measures to prolong the outbreak. And what he was referring to is called epidemiologically flattening the curve, meaning you have an epidemic that spikes and you're trying to flatten it so that the cases spread out over time. Now, that matters because if they do not, we're going to flood the healthcare system, not have enough ICU beds and things like that. And this technique has been around for thousands of years. In Leviticus, 7th century before the Common Era, there's reference to social distancing and quarantine.
I remember him well.
So these are techniques that are as old as human beings.
You know, my biggest problem with this is someone who has no skills in the public health area is it seems like it's every man and woman and institution for themselves. Just to give you a couple of examples. I mentioned Harvard University and 4 others saying go home, we'll do online classes. Boston University not taking that stand.
Not yet.
Let's go out to Ohio for a second. Sanders and Biden canceled their rallies in Cleveland tonight. Governor DeWine, the governor of Ohio, has said he is urging sports teams not to allow spectators in. Well, in Massachusetts, Friday night the Celtics are playing at the Garden. There are going to be 20,000 screaming fans. Yeah. It seems like it's as I say, everybody can make their own decision, which it seems to me just creates confusion with the public.
No, it's frustrating and it's confusing. I think I have a little bit more sympathy for people who are responsible for making these decisions, frankly, because it's not so clear what the right decision is. Right? What we're balancing is the impact that the decision will have on the epidemic versus the social and economic costs. And in some respects, the governor has a different set of data in his hands as the people who are running organizations like universities or sporting events. Now,
should we consider economic costs, by the way?
We should.
When we're considering a public health crisis, we should?
I think we're always considering economic costs, whether we're honest about it or not. So, because ultimately economic costs also have public health implications. And you and I have discussed this in the past. So we cannot simply say, well, let whatever happen, because the economic costs are then going to affect us later on.
But again, I want to talk about the real person who's sitting at home confused. Again, I don't mean to pick on you, but let me pick on you just for
right here.
A second, if I may. Okay, speaking to their spouse, Harvard closed. Yeah, but BU didn't. Wait a second. Governor DeWine says don't go to a basketball game. Charlie Baker says, well, if you're old or have some condition, don't go. What is the average person to conclude from all this?
I would take a step back and sort of apply some common sense measures. First of all, to think that we can all do as much as possible is pretty common sense personal hygiene. Wash our hands a lot, not be around people who are sneezing on us or coughing us. If we are sneezing or coughing, not to do it on other people. Not if we are vulnerable. And by vulnerable, I mean people who are older ages or who have some sort of immunosuppression, not to be around large crowds. These are common sense measures that we should be taking.
But again, I don't mean to beat a dead horse, a horrible choice of imagery, but in Ohio, where, by the way, there are only 4 cases as opposed to 92 here confirmed, the governor is saying, healthy, unhealthy, I don't care what you are, you shouldn't go to a basketball game. You shouldn't go to a football game. So, again, let's...
Well, the phrase that you've heard a lot these days is out of an abundance of caution.
Exactly.
And you know, it's a useful phrase, but there's no clear, bright line as to where the abundance of caution comes in.
Let's move to the national level, if we can. Here is Donald Trump on the coronavirus today. Here's the president.
Democrat governors are saying we've done a fantastic job. We're prepared and we're doing a great job with it, and it will go away. Just stay calm. Everybody has to be vigilant and has to be careful, but be calm.
Is he doing a fantastic job? Is the federal government doing a fantastic job?
Well, I think there are many things the president said that actually are correct. This will hopefully all go away eventually. He's correct. He's also said we have the best minds in the world working on this. He's also correct on that. He's also said that doesn't help us to panic. He's right on all of these things.
However,
now the question is, what role does the president play in actually helping get us to a place where we understand what's going on? And in many respects, the president has at his disposal leading experts from all over the world. And I think we would all be well served if he took a back seat and let the experts, leaders of CDC and NIAID, to actually guide us on this.
One thing they seem to agree upon is that we have millions of tests have been sent out, but I read as recently as an hour ago that we've only done 7,000 tests in the United States as a whole. Where's the disconnect?
Well, if I may, the disconnect is that we have disinvested in public health infrastructure for decades, and this is in some respects, coming home to roost. We have not put in place systems that allow rapid dissemination of tests like this. Now, you would expect me to say that. I'm a dean of a school of public health, but I actually think public health is what we do all the time. And public health, by the way, as you and I have discussed, is political. I mean, this is political.
When the president minimizes the potential impact of that, now I'm getting back to people like me sitting at home, does he not basically say to people, you don't need to be nearly as prepared as the experts tell you you have to be? That's a reasonable conclusion to make from the leader of this country, yes?
I would encourage people to listen to the experts. And,
okay,
and I often send people to the CDC website, which has excellent information on this.
Well, you're an expert. Let me quote you to you, if
Please.
I can. Reasonable epidemiology. GIC, is that how you say it?
Epidemiologic.
Thank you very much. Or doubt as to whether COVID-9 is as dangerous as some are suggesting.
That's
now,
correct.
so what are you saying?
Well, what I was referring to is there's a fair bit of controversy about what the case fatality rate, which means out of the people who get it, how many people will die. We've heard numbers as high as 3.7%. I think most reasonable estimates are it's probably 0.5, 0.6%. Now, we should be clear that still means if you have hundreds of thousands of people affected, that percent is still a lot of people.
Yeah, but that's much closer to the traditional flu than it is to these predictions.
That's correct.
So if that's the case, why are we not worried about what Trump says we should be worried about, the 20 to 60,000 deaths from the traditional flu rather than the coronavirus?
Well, that's a very good question. I think we should be worried both about the flu and coronavirus. We've had about 50,000 people die from the flu this year. And that's something we did not talk about enough. I go back to my point. We should be talking about these points all the time.
But if the fatality rate is so close...
It's close, it's higher. There's a really interesting story here, Jim, which I think in a year's time when all this is
What's
over.
That?
The story is why we have come to see this the way we have. Why have we come to see this as... And I think in large part is because it's novel and it's scary. I think it's reasonable for anybody sitting at home to be afraid of a novel virus, something we did not know before. And the science is catching up to it. In a year's time, we'll know a lot more about the science, but we're living in this today.
President Xi in China did essentially a victory lap by going to Wuhan today. Is that deserved? Because it seems to be, if it is deserved, that's one glimmer of good news in the sea of bad news.
It's a tricky question. The question is that essentially what China did was social distancing, right? Isolating Wuhan. They, in some respects, said, don't worry about the social economic consequences. We're going to do this.
Well, Italy seems to be saying a similar thing.
Italy's saying something similar, although slightly more complicated because it's Italy.
Should we be doing more of that?
Well, I'm not sure. Today, probably not. Tomorrow, it's another conversation.
What's the trajectory of this thing as far as you can tell? I know it's uncertain. I know,
What
but
we've
realistically speaking, what's the expectation?
What we've seen in other places is that there's an epidemic curve, which means that we're going to see some doubling over a period of a few days. The question is when the curve will flatten out. And going back to Governor Baker, declaring a state of emergency, what he's trying to do is to try to stretch out that period so that we can make sure that the health system is ready to catch up with the virus.
If you were the governor of Massachusetts right now, would you direct that there be no spectators at athletic events? Would you direct that the Boston Marathon be canceled?
I think the governor of Massachusetts has data at his fingertips that I don't have. It would be presumptuous for me to say anything else.
Fair enough. Dean, it's good to see you.
Good to
Thank
see you as
you
well,
so
Jim.
much for
Thank
your
you.
time. Appreciate it.